and Human Services, Interoperability and Business Alignment Committee together.
You are all set, Senator. I've let in the public and we are live streaming, so you are good to go.
Thank you. I will read our right to know script and I welcome all of those who may have joined us. That I am Senator Jay Kahn, Chair of the Committee to Study Mental Health and Human Service Business Process Alignment and Information System Interoperability. Today, we are having a meeting to review updates and discuss content for our final report. Before we get started, I will read through a checklist to ensure that the meeting that we are holding is in compliance with the right to know law. As chair of the Committee to Study Mental Health and Human Service Business Process Alignment and Information System Interoperability, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to the Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I'm confirming that we are providing public access to the meeting by telephone, with additional access possible by video and other electronic means. We're utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform. And the public has access to contemporaneously watch and or listen to the meeting on Zoom or YouTube and via phone by following the directions and links that were provided in the General Court website. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remotesenate@leg.state.nh.us or call this number 603-271-3043. In the event the public is unable to access the meeting, will be adjourned and rescheduled. Please note that any votes taken during this meeting shall be done by roll call vote. And finally, let us start the meeting by taking a roll call of attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during the meeting, which is required under the right to know law. I am Senator Jay Kahn. I am in my home in Keene. My wife is somewhere elsewhere in the House. May I recognize Senator Fuller Clark?
Yes, good morning, Senator Martha Fuller Clark. I am in my home in Portsmouth, and there are other people in my house, but not where I am.
Thank you. Representative Christy Bartlett.
Hi, I'm Representative Christy Bartlett. I'm in Concord in my home. My husband is in the house, and I have a very noisy cat right on my feet. I'm sorry. I'll mute me.
And I don't see Representative Edwards.
No.
Correct?
Yep. And nobody's on the phone.
I will resend her invite just one more time.
Yeah, and I don't see Representative Smith, which he joined us late in the designating membership process. So I don't think he's made it to a meeting. Not that we've had many in the recent. But I will call us to order in the interest of trying to complete our work efficiently this morning. You have two documents in front of you. One is from 2018, and the other is dated October 1st, 2020. And the reason I reference the 2018 report is that, and I want to make sure that I have that. 2 years ago, the conclusion of the 2018 report on the same committee title, it did recommend the continuation of this committee into our 2019-2020 legislative session. It had recommended the creation and implementation of a master client index and some legislation that would facilitate interdepartmental transfer of records, in particular for those patients who required substance abuse disorder treatment, to allow information to be exchanged between healthcare and behavioral healthcare workers. That was accomplished through legislation in 2019. The client information, the master client index was accomplished as well. At the end of that report, was a roadmap and some capital investment that was recommended to help align business processes and facilitate greater information interoperability among serving entities serving mental health care patients. So much of that roadmap yet needs to be implemented, and that was the reason for this committee to be established, to make sure that we could create a timely roadmap and pass that to the next legislative session. In the interest of doing so, Ms. Weaver and Mr. Wieters, our DHHS advisors through this process, have provided us with our October 1st, 2020 report. It makes some recommendations for the committee so that relative to trying to move towards a final report, hopefully the outcome of this meeting, we have 3 recommendations that they have put before us that continue to make progress on interoperability in the best interests of the patients and clients served by our health and mental health care services in the state. Then they have updated the report from 2018 to reflect the information systems that they have both asked for capital funding and provided it in the roadmap so that we can see both what has been accomplished and what yet still remains on the roadmap for the next 2 years. So I hope that's enough background for all of us to begin to hear from Ms. Weaver and Mr. Wieters about the roadmap, the pieces that need to be implemented along the way, and lead us back to the final recommendations that we have before us. Turn that over to, if there are no questions currently, turn that presentation over to HHS.
I'm going to turn it over to Dave to lead us through the discussion.
Thank you, Lori.
Thank you very much, Chairman Kahn and Representative Bartlett and Senator Fuller Clark. Thank you for the opportunity to have this discussion with you. I'm going to go ahead and share my screen. I do have a brief presentation to walk us through what Senator Kahn indicated. Can everyone confirm that they can see my screen?
Yes.
Thank you very much.
Yes.
So now I just have to get it to the next screen. So our goal here is to go through how we evolved our client-centric approach and update you on where we're at with our interoperability roadmap. And then sort of go back and remind everyone about health and human services at a real high level at a glance, and then tie it up with our recommendations and answer any questions that you have. So over the last several years, Health and Human Services has been looking to integrate our disparate data sources into a centralized enterprise business intelligence environment and create more of a client-centric model. So this is a elaborate overview of a graphical representation of our different data sources. So we leverage data from multiple departments as well as multiple divisions within our department to provide our services to the clients of New Hampshire. And we discussed earlier, Senator Khan discussed our master client index that we were able to accomplish over the last year and a half, and we continue to want to expand upon that. So right now, disparate data that was not integrated is criminal justice information that we leverage for licensing and registry in our childcare information system, DCYF for children, youth, and families data, economic and housing supports data, as well as we go through and we had a very focused effort on our Medicaid, behavioral health, and public health components as it related to the opioid crisis over the last year. As indicated in the report for 2018, we did request capital funding to extend this solution. That was not actually approved. And so what we did as a department is we sought funds through the Center for Disease Control and Prevention to really focus our efforts on the opioid crisis and expand our system while we were waiting for an opportunity to submit additional capital requests to continue our efforts in the SUD, substance use disorder, as well as behavioral health, mental health components of this committee. So as we go through a client care coordination, our goal was to bring in all of our different programs, providers, and services into a centralized environment, not only in our enterprise business intelligence for reporting, but also for case coordination, case management, care coordination, and other solutions. So you'll see with our recommendations as we move forward, we're going to be implementing closed loop referrals for allowing for all of our providers to be able to go into one network to do a referral with informed consent by each client or patient, as well as continued efforts in our business intelligence. So in terms of our interoperability roadmap, to some of you, this should look somewhat familiar from our last report. I'm using the same graphic so that we can just continue where we're at. So back in January 2020, we did adopt our HHS, or Health and Human Services Data Governance and Management Solution. And what that really was focused on was making sure that we were handling the data in compliance with our state and federal laws and ensuring that the people that needed access to the data had access and the people that didn't have a need for access did not have access. So that's really what that governance and management solution was meant to do. And we have that ability to process data as a result. And then back in May of 2020, we sought to complete our outcome-based dashboards associated with Medicaid and commercial claims, our long-term support services, child welfare, emergency department surveillance, and behavioral health data. And that was really focused from the CDCP funds to really with an opioid crisis direction. We did have a brief demonstration with this committee, I believe, earlier this year regarding that dashboard. It has not actually been published publicly, but we do leverage it internally for helping with our understanding of the opioid crisis and the outcomes associated with the services being provided. We anticipate publishing that sometime in the next 2 quarters, either towards the end of this calendar year or the beginning of next calendar year of 2021. In September, this past couple months ago, we implemented a case management solution leveraging our Salesforce environment in Medicaid quality. And this is leveraged to look at the claims and benefits that the managed care organizations are providing to our citizens and being able to increase and improve our quality of services as a state. That's important to this effort. As a result of implementing Salesforce, we're able to build interoperable solutions between case management Whereas before we had multiple different platforms, it was difficult to integrate. We are standardizing on Salesforce for our case management where possible, and it is able to integrate with our other provider systems that are in our hospitals and community mental health centers, as well as community-based organizations. So we also implemented contact tracing in our public health environment on the Salesforce platform, along with Child Care Information Services Registry is in there, and we will by the end of this year also have Child Care Information Services licensing. So all of our child care facilities will be leveraging Salesforce along with our contact tracing for the COVID-19 pandemic. And then finally, we completed the Children, Youth, and Families intake system in Salesforce. However, we have not gone live with it at this point, as we are waiting to move into the next steps of assessment and case management in that environment to be able to go live all at once together. As we continue forward, we are looking to implement, and actually in the last about 3 days ago, we went live with our Office of Ombudsman's case management solution, again in Salesforce. And what this really does for us is, if the data is needed in different divisions, it's all in one system. So we can enable the switch to say, okay, this person's authorized to see the child welfare information, as well as the contact tracing information, as well as existing reports in the quality assurance area, based off of the privileges that that individual, or the role of that individual in the system. So that way, if I was, for example, David Wieters was in all 3 systems, one caseworker would be able to look at all of the different interactions that David Wieters is having in that system. Whereas before, if we wanted to do that, we would have to have them log out, log back into another system, remember the person's name or copy it down onto a Word document, and then search for it, and then continue to the next system in the following. So this really reduces the complexity of getting information, as well as improves the time to delivery of services. So as opposed, and reduces our errors. Moving through, in this fall, fall of 2020, we continue to implement the admission discharge transfer solution that the district waiver enabled, and actually the legislation passed by this committee in previous year enabled us to implement with the IDNs, or integrated delivery networks, across the state. And what we're doing is we're implementing that solution now in our New Hampshire hospital to complete that client-centric solution. And then as we move forward with that, we are anticipating with we submitted capital request to continue funding that after the district waiver demonstration was complete, which is actually nearing the end of in this calendar year, and then final reports will be June of 2021. And so our goal is to be able to continue the efforts that were already put in place of that interoperability between providers, health and healthcare systems throughout the state by funding that continued effort. And then I'm just going to go into the continued here, where we're actually leveraging cares.
David,
Certainly. Sorry, Senator Khan.
Could you just tell us how that's going to be continued forward? You said seek funding to continue.
I apologize. Yes. So what we submitted a capital request to continue the funding and expand the admission discharge transfer solution to all of the IDNs. There is one IDN that is not on it. And the goal was to be able to leverage the interface to that solution, so that we would have an entire solution that everyone in the state, all the providers participating, would be able to see admission, discharge, and transfers of patients between those providers.
Thank you.
And then as we're moving forward, we just contracted with Unite Us for a closed loop referral system with a substance use disorder focus. And what that system will do for us is, right now, many of our community-based organizations, our community mental health centers, as well as our healthcare facilities, in order to provide a referral for services, they actually have to do several different documents, and it's usually a phone call or a mail-in process, or they give the referral to the client and say, go to this address or call this phone number and you can get services. One example is someone that shows up in the emergency department today for some other related physical injury is expressing to their nurse practitioner or their doctor that they are having trouble paying their bills or getting food for their family, and it's resulting in them coming to the ED for services or whatnot. The idea there is a lot of times those ED services will provide a referral to say, well, there's a food pantry, here's the food pantry's number. I see that you need potential help with cash assistance. You can call Health and Human Services, and they give them the information, and then that person leaves their service, is discharged from the emergency department, and that case may just get lost because the person may not be able to call or might not have a phone or might not be able to seek those resources. This closed loop referral system will allow the ED and any provider to go into the system and basically say, hey, this person needs food services, this person also needs housing supports or whatever, or they might need mental health caseworking support. And that referral would then be sent out to the different agencies that are registered on the network. They could accept it, and they could actually proactively call the individual because they would have the information. And this will be all done through a single informed consent with the patient at time of service. So that's the goal, is that we would be able to connect people to the services and not lose them because of like they call a phone number, the person doesn't have the availability. So that's the goal of the closed loop referral system that we're implementing by December of this year, and then continuing to expand across our network, across our state in the subsequent 9 months into fiscal
And
year.
funding for that is in place, and you're confident in the implementation schedule.
Funding for that initial implementation with an SUD focus is in place. Continued funding after fiscal year 2021 is dependent upon the capital request that we put in our recommendations to continue to expand that and continue to support that system going forward. That would be, so this funding will take us through October 12th of 2021, and then we'd be looking for funding to continue that effort going forward. So just to speed it up a little bit here, so the January through June 2021, we're going to continue to expand, as I indicated, the closed loop referral system. And our intention is to publish a treatment locator services website for our clients to be able to seek on their own different services in the state and see and get that information. And then expand to other healthcare facilities. So the initial focus is the doorways. The 9 doorways within the state, and then we're expecting to expand beyond those. Pardon me for a second, I just have to cough. Sorry about that. As we move forward into the spring of 2021, Medicaid interoperability, there is a new CMS interoperability and patient access final rule, which will require all states to implement a portal for all patients of Medicaid to be able to access all of their claims, all of their benefits in a single place. And that's required to be in place by June of 2021. We will be implementing it as a state for our fee-for-service solutions, which is about 6% of our population. And then our managed care organizations will be implementing their portals for their beneficiaries for the remaining 96% of Medicaid recipients in the same time frame. This will actually provide a really robust environment for Medicaid recipients to understand what services have been rendered and what services are available to them.
And that's funded.
That we have identified 90-10 match with CMS, and we are seeking the 10% general fund match right now. It is a requirement, so if we don't find the funds, we would be penalized yearly, which would be in excess of the 10%. We don't anticipate having troubles finding that funds though at this time.
May I ask a question?
Within the HHS current budget.
That is our goal currently, yes. Yes, Senator
Thank you.
Khan.
Yes.
May I ask a question?
Representative Bartlett, sure.
Thank you. Representative Murphy I'm not sure that this has anything to do with this, but she had brought forward a bill that did not make it through all the way through, and she's bringing it forward again this term, that had to do with copays. And I'm wondering, for mental health services, I'm wondering if this system will help the department track those who might have insurance, but very limited insurance. What was happening was that because there was a delay in the amount of time it took to process, that clients were getting some services, but then saying they'd run out of benefit. Would this system help track what the benefits for individuals might be?
No, this system would not, Representative Bartlett, but we do have our integrated eligibility system that does track benefits for state recipients of Medicaid services and actually our other benefits for other areas of our division. So that's where we would be able to track when people are eligible or when they might fall off the list of eligibility. And it is an automated integrated system with our children, youth, and families, as well as our long-term support services, elderly adult care, and our child support and Medicaid.
Are you familiar with that bill that you brought forward?
I am not familiar with that bill.
I will follow up with you on that later.
That would be great.
And just so that we can just talk about that one. Thank you.
All right, we're down to spring 2020 with the Medicaid implementation. Are there these other couple of steps in 22 and 3 that are influenced by your capital request?
I would say the continued implementation of the master client index and migrating it and including a master patient index would be influenced, and the continued automation of reporting from our Medicaid system is certainly influenced from our capital request. And then the last one there with the implementation of the closed loop referral system across all sectors of government, including education, insurance, and DHHS, would be influenced by those capital requests. So the idea on that final part is a lot of our clients get referred from their schools that they're in. So they'll go seek the school nurse, and they'll get a referral for services or a referral for support. It will either go to the families if they're a minor, or if they're in college, they'll get a referral for those services while they're here. And enabling them to be able to leverage that environment would greatly improve our care coordination for those individuals that are attending schools in our state.
So a properly licensed professional in a school would be able to enter and access information from the database.
That is correct, Senator Khan. And essentially, they would not necessarily be able to just search any information. It would be information that is pertinent to the children that they're serving and pertinent to the specific case that they're trying to provide. So there is going to be a lot of governance and permissions-based environment, permissions-based rules in place to ensure that like a licensed provider in an education stance may not have access to mental health information, for instance. There's very tight guidelines around who can access 42 CFR Part 2 data. And so that's where we're working with attorneys to identify how we can make that happen and improve this care coordination as we go forward. Is there any questions on the roadmap? I know that was a lot of information, but I just wanted to stop there for a brief moment. Hearing none, I'll go to the Health and Human Services at a glance. And here you see the integrated eligibility New Heights system. And it serves 1 in 5 New Hampshire citizens and processes a little over 750,000 transactions per day. This system is responsible for eligibility of benefits, not only Medicaid, but all of our different integrated systems. So you'll see $1.9 billion in services yearly. And of course, it is federally compliant and secure. In contrast, we have our Medicaid management information system that is solely focused on Medicaid recipients. And it's processing a little over $1.7 billion in Medicaid payments annually. And as of this year, we are over 200,000 enrolled clients. That is in contrast to previous reports where we were right around 180,000. We've had a little over 20,000 additional recipients in the last year. As we go through, we leverage those 2 main systems to ensure that we can improve our care coordination for Medicaid recipients, and they work in conjunction with each other, and they are interoperable systems between each other. We have several other interoperabilities that I discussed a little bit briefly earlier in terms of in our previous legislative session, we were able to complete that master client index. And that really what that was is connecting our clients between our child welfare, child support, our Medicaid system, as well as our eligibility. And what's not listed here is our elderly adult care system is also integrated in. As we move forward with the opioid crisis and the funding from the Center for Disease Control and Prevention, we have included our behavioral health system in that master client index. However, there's more work to be done to model that data and really understand how it relates to the other different systems already in the master client index. And that's really where we're looking to continue to extend the business intelligence platform, that master client index, and then moving into a master patient index. And what the difference between a master patient index and a client index is the client index is all of our clients. The master patient index, we have an opportunity with the implementation of our immunization information system in our public health, where they're going to be collecting the immunization information for our citizens, specifically surrounding the COVID-19 vaccine as it gets developed, but also for other immunizations throughout the state. We're partnering with healthcare providers, and we also are going to be doing our own. We're planning to implement our own vaccination sites as we have done for COVID-19 testing. But that index, that information, that immunization information system is going to actually be probably the one system that has the most data surrounding our patients in the state of New Hampshire. And so that's where we're looking to expand our master patient index to include that so that we can provide services. Representative Bartlett, I think you raised your hand with a question.
Thank you. Sorry, I didn't mean to interrupt you. Is this immunization index the one that we have heard referred to as we're the last state in the union to have this?
You are absolutely correct, Representative Bartlett. We are the last state, and we are excited that we were able to contract, and we anticipate having it implemented in December.
December of this year?
Of this year.
Great.
So our
Thank
goal
you.
right now is December 7th of this year.
Super.
Does that fit under your next steps, where you have expand MCI? Is that an additional expansion?
It is ongoing. It's not part of the capital request. So we have that included in existing funding for this fiscal year, where we're anticipating leveraging CARES Act funds as well as public health grant funds to implement both the immunization information system as well as the integration with the enterprise business intelligence. Now, when it comes to the master client index, including that in there, we have not actually explored that yet. It's not on our roadmap because we're just trying to figure out how we can leverage that data legally in our master client index in the master patient index. So we're still evaluating that, and we would anticipate that being in a future funding request for probably either future grants or 23-24 biennium budget.
Okay. I this slide is not part of the presentation that we have for final report. I just
I
noting.
apologize that this one I took from, essentially it's incorporated some of the data or words that were written in the draft report that I provided to you. I think you referenced it as October 1st document.
Yeah.
And it was trying to take some of the words that were written in there and put them into a graphical representation.
Yeah, and
I
think it does it well. It just caused me to ask about the immunization part. And I wonder if a suggestion for our final report is that this slide does do exactly as you said. It might be valuable. Anyway, keep going.
So if I hear a suggestion of including the immunization information system in here and a couple words about that. Is that accurate, Senator Khan?
Well, mostly I don't want to, as you said, it's not integrated into this master client index nor the closed loop. So I don't know why we would. I don't think you would include it, and it's why you haven't included it, I suspect. But this is a good summary of the written first 3 pages of the report. And I think that this might be a valuable slide for us to include in a final report.
Thank you for the clarification, Senator Khan. I appreciate it. So we've already really gone through most of the next steps. We're continuing to expand our long-term support services dashboards with specific focus on the elderly adult care system and the developmentally disabled population. We're wanting to expand that master client index, as we discussed, surrounding the drug and alcohol services. So we have the data included in our system, but we really haven't had a chance to really link it together properly and understand how that drug and alcohol services relates to a child in children, youth, and family, or an elderly recipient in the elderly adult care system, or as it relates to Medicaid claims in our MMIS. So that would be our looking at expanding of that MCI, including public health systems like the immunization information system. And then as we move into the closed loop referral rollout, we do anticipate expanding that, and then expansion of our case management system that will really help move towards a single platform to integrate our different cases, our different clients' services being received. Now, a final slide here, we have our high-level recommendations that you will see in the October 1st draft report for you. And it's really going through implementing that master patient index and improve upon the existing master client index. And that's directly related to a capital request that we submitted in the report. And then going additionally on those capital funding requests, we are looking to continue the services of the admission discharge transfer system, as well as expand that to make sure that it's integrated across all of the IDNs as we move forward and the providers using it. And then the final is that continued expansion of the enterprise business intelligence platform, which isn't just the master client index, but it's really taking the master client index, taking the master patient index, leveraging the data that we bring in from systems like closed loop referral, and providing dashboards or visualizations of the data in a way that our employees and our citizens can leverage it to improve their own services or improve the services that we provide. Some examples of those is we've been leveraging that environment for the COVID-19 response. If you go to nh.gov/COVID-19, That's where we have several dashboards leveraging this environment, and it is utilizing data sources throughout our enterprise business intelligence platform to coordinate and provide how we're seeing the COVID transmission of the pandemic, and how we can actually address where services are needed. With that, I'm done with the presentation. I know I took a lot of time, so I appreciate your time today. If you have any questions, Senator Martha Fuller Clark.
I have a question for Senator Khan. Unfortunately, I have a conflict at 10 o'clock.
Yeah.
And I need to know if you need a vote from me. I really appreciate this presentation. It's been very helpful. I am fully in support of the draft report. So Senator Khan, how would you suggest that I proceed?
I appreciate that, Senator Fuller Clark, and I think a motion would be in order to move the committee accept the 3 recommendations before us and incorporate the additional comments and slides presented to us today.
So moved.
Seconded.
Thank you both. I'll ask for a vote. All those in favor say aye.
You have to
Aye.
do a roll call. You have to do a roll
I
call.
do have to, okay. Senator Fuller Clark,
Yes.
and Representative Bartlett,
Yes.
and Chairman votes yes. That's a 3-0 vote. And thank you, Mr. Wieters, for your
Really excellent,
presentation.
excellent presentation.
That really helped me. It's been months since we'd even talked about using some of this language, and I needed a repetition to help me.
Senator Khan, do you need anything else from me?
No, if only your sage advice of, are there any other materials that you found helpful here? I think that one slide that we saw
Was very helpful, and certainly the snake-like chart, quite extraordinary.
Yeah, yes. No, Senator Fuller Clark, I think if there's no other business for us today, I will, Tricia, can you just clarify for us, traditionally, each member of a committee has signed off on a final report.
Right.
We'll be preparing that, you and I, based on this October 1st draft,
Right.
and incorporating one more slide.
Mhm.
And I don't know the next step. I can't
Sure.
exactly tell Senator Fuller Clark what that is.
So this year, because of COVID and things are different, we will be emailing the reports. So I think once we put together these changes, integrate them into a final report, we can send it to everybody on the committee and they can approve through email. And then I will put everything together in an email packet and send to those that need, Senate President, the governor's office, et cetera, through email. That's the way it's going to happen this year.
So all of us, beginning of next week, ought to look for an email from you,
Yes.
right, Tricia,
Correct.
asking for our assent to this final report.
Right.
And we send that back to you.
Yes.
And then you'll coordinate the final report to
Right.
all of the listed
Everybody.
entities. Okay. Very
Thank
good.
you for all of the hard work that you've done, Tricia, and
Thank you all very
David and
much.
Lori. I mean, all of you have done a tremendous job for us.
Great.
Thank you.
Great. Well, thank you. I'm going to adjourn the meeting, but if we just use this Zoom for one final check-in on the final report, but I'd like, in particular, David and Tricia and Lori, if you wish, to stay on just so that we can coordinate the pieces, getting to Trish's inbox so she can put it together today.
And just, you gotta take the roll call to adjourn, Senator.
Okay, motion to adjourn. I guess I will make that. Representative Bartlett,
Second it.
Okay.
all in favor, say aye.